Hello and welcome to Everyday Medicine. I'm Dr. Luke and I'd like to thank you for joining me on this podcast series where we share conversations with colleagues exploring their special interests in medicine and bringing insights, ideas and advice which I hope will be applicable for our medical practices. In this podcast, we are exploring the concept of death from the feet up with expert physiotherapist Allan Abbott. Before starting, however, for Australian audiences, listening does give you eligibility for your CPD, so log in and add this as an activity. You may also consider journaling, reflection, and adding to the review and performance section in your CPD. Well, falls in the elderly are associated with significant morbidity, and after a serious fall indeed, predict the transition within a year of 10 to 15% of seniors to long-term care facilities. Additionally, the 1 year and 3 year mortality for seniors is 16.4% and 40.5% following a report of more than one fall in the past 3 months. This is about double the average mortality. When a hip fracture complicates the fall, the all-cause mortality is 3 times more than for the average population and as high as 27% in 1 year in some studies. Many factors are at play in the deterioration of senior patients experiencing falls and mobility decline. Faltering stability may arise from inadvertent overmedicating with hypotensive agents and beta blockers, or from the consequences of previous cerebrovascular accidents, Parkinson's disease and myopathies. Excluding these more overt and obvious conditions, one of the greatest determinants of falls is toe strength. Toe strength affects stability, which is a problem in an estimated 1 in 4 people over the age of 65 years. The problem of falls relating to toe strength, foot proprioception, and distal muscular control piqued my interest and led to a curiosity to explore this issue further with expert physiotherapist Allan Abbott. Well, Allan is known for pushing the boundaries of knowledge and learning and in providing a fresh perspective on many functional issues affecting us that one may not have considered previously in any detail. In an earlier podcast, Allan helped us explore breathing techniques designed to enhance physiologic function, and I'd commend these episodes, including episode 139, 140, 153 and 154 to you. Now, the concept of dying from the feet up warrants careful examination and a thorough understanding. Hopefully, after listening to this podcast, you'll believe, as I do, that we could all benefit from the ideas Allan explores. I was keen to learn more about the major factors contributing to foot problems, the exercises we should be considering and recommending, as well as performing regularly ourselves to improve toe strength, balance and dexterity. The role of footwear and how one may select good foot support in terms of orthotics is also of significant importance and interest. So if you are interested in improving foot function and to limit morbidity both for your patients and yourself, please join me with Allan as he navigates this fascinating topic. Welcome again, Allan, to Everyday Medicine. Allan, you are one of my frequent flyers, one of my favourite guests, partly because you say yes to my requests.
When there's a gap.
It's only costing me a dinner tonight.
Yeah, when there's a gap, you'll slot me in.
No, I'm honoured to have you. And we talked about breathing, and that was really, really interesting. And I've employed a lot of those pointers, and I found that extremely valuable. I'm now an elite athlete.
Excellent.
Thank you very much. But we have another topic, important topic to talk about, which initially I was curious when you brought this up, Allan. It's death from the feet up. Death from the feet up. Now, tell us about this topic and tell us, why the title, and let's discuss this in this very interesting podcast conversation we're going to have.
Thanks, Luke. I called it that simply because I knew it would grab your attention and invite me in to find out what it was about.
Yes.
So there's some detrimental effects on foot health and also footwear choice, which can have an effect on pain in the feet and function of the feet. But the predominant things we look at would be toe strength and stimulation of the foot to get feedback for balance. And why that is important is because we're looking at balance and related to falls.
Which have a major impact.
We'll talk about the devastating effect it can have.
On life expectancy.
But let's not just talk about seniors or elderly people. Let's talk about athletes, for example. So it doesn't matter what movement you try and impose on the body, you must have stability to take that load.
Yes.
So there's a couple of good sayings. One is you can't put a jet engine on a paper plane. What's that mean? Or you can't shoot a cannon out of a canoe. What does that mean? It simply means that if you haven't got stability...
Not footy mouth.
If you haven't got stability, then any load you're going to impose,
yes.
you're going to get energy leaks
yes.
As you try and move that load. So stability starts from the feet up because it's the only contact we have with the ground.
Yeah.
Whether we're balancing, whether we're walking, whether we're running, whether we're lifting weights, it's the only contact we have with the ground. Interestingly, we talk about ageing and all the stuff that goes wrong. You lose muscle strength, you lose your VO2 max drops off, all these sorts of things are going to affect your longevity. But foot strength, and in particular toe strength, is very important because stats are something like this. It depends where you look for them, but sometimes you'll find this is sort of middle of the road, if you like. In seniors, 1 in 4 fall. 25% of those who fall and fracture a hip or a femur are dead within 12 months. Another 50% of that group will have altered function ongoing. And that's devastating. That could mean from behaving normally to using a stick, from using a stick to being in a wheelchair.
Yes.
And we know the effects of not being mobile.
And from being independent living to being in
exactly
assisted accommodation or high-level accommodation.
Yeah, and it doesn't seem to be, maybe it's the circles I move in, but I hear about falls every week.
Yeah. My son was a bit drunk, Alan. He had a fall.
Yeah.
I don't think we're talking about that.
No.
We'll just digress for a moment.
We did.
That was at the Richmond.
Yeah.
It was a Bucks party, actually, and I really enjoyed it.
You did?
I was there, yes, but I was very, very sober because I was the
trying to hold him up.
Allocated driver. He's got good toe strength.
Good,
but
just as well.
But nonetheless, at that point in time, his neurology just let him down.
Exactly.
Just a little, as did his brain.
Yeah.
Slightly. But it was
like
he
didn't hit his head.
Yeah, exactly. Yes. But, so what...
So if we're going to fall, very often it's at the initiation of gait. We take a step,
yes,
put our foot out, and something goes wrong. Or we might step off a curb,
yes, and
go down,
or slight irregularity in the surface.
Exactly, yeah. So while we're walking on man-made surfaces, through supermarkets, all that sort of stuff, not too bad. But get out onto terrain that's not quite right, and it's a challenge.
Alan, when I have fallen, it's generally been when the surface is a bit wet. I haven't recognised that. And that's included in operating theatres, actually. Someone's left a bit of gel on the ground, and I've gone for a slider.
Yeah.
I've hit into a nurse, or I've hit into she's holding me up. Yeah. I've hit into a trolley, and so that's another thing. When things are a little bit wet, and I've had patients who have fallen at supermarkets, and there's just been a bit of moisture on the ground, and I guess that the proprioception disappears at that point.
It happens to anyone. I remember one fellow, very elite athlete, and he used to swim at Harold Holt Pool.
Yes.
And he'd run first. Went for a run, he's coming back, he's going between the cars, there's lots of leaves on the ground, they were wet.
Yes.
Down he went. Rotator cuff gone.
Yeah.
When he put his arm out to fold himself up.
Yeah.
So that, that's a big recovery time.
Yes.
And, so it does happen.
Well, what are the...
But interestingly...
Yeah, the major contributing factors.
Well, one is toe strength.
Yeah. Okay.
Right? And there was a study done by, I can't think who, but a study done on seniors of people who had fallen and people who hadn't fallen. They might put them into two groups. They tested their leg strength, quadriceps, that sort of stuff, their muscles acting over the ankle, that sort of stuff. Not much difference between the two groups, the non-fallers and the fallers. Where the difference was, the falls, they had very, very poor toe strength compared with the group that didn't fall. Right? So it's a major contributing factor is the toe strength.
Do you think that, like in our senior patients, it's because there's some arthritis in that, in the toe joints?
This is disregarding any of that.
Right, okay.
Because you can work around that.
Okay.
Right? Other contributing factors, sensation.
Yes.
What is coming back via your foot to tell you what's going on under it?
Yeah.
So if you look at the sole of the foot, there's something like 200,000 nerve endings. right? When we put our foot down, we get vibration back.
Yeah.
Okay, so it picks up the vibration, sends the message, we do our thing. Again, with ageing, what happens at about 70 years old, that sensation has diminished by 20 to 25%. So it's going to take 20 to 25% more force or input to get the same feelings and all that you did before. By age 85, it's decreased 75%. So your nerve conduction and all that sort of stuff has dropped off. So no wonder
Inputs are weak. Yes.
elderly people fall.
Yeah. Yeah.
The other thing is, if you talk a bit of myology, in skeletal muscle, you have fast twitch, slow twitch fibres. Now, slow twitch fibres are the endurance type. They can sort of keep going forever. The fast twitch are very quick acting, and in the lower limb we have a lot of fast twitch fibres when we're young.
Right.
As we age, they drop off.
You have a lot of fast twitch fibres, I think, Alan, still. I've seen how you walked up the stairs, came in. You're an exponent of fast twitch, I would say.
Fast twitch.
Yes.
And
you're an ornament to the fast twitch.
We'll put a bronze statue out the front.
Yeah. Well, you've just got to be premier for 12 years or something and bankrupt the state.
Yeah.
Yes.
Interestingly enough, all those things we just spoke about, you can do something about.
Okay.
Which is good.
Yeah. Okay. Will you take us through that?
Well, certainly will.
Yeah.
We'll get there.
Footwear playing a role?
It certainly does.
Yeah.
Glad you asked.
Yeah.
If you think about this, years and years and years we've been going on with foot in a shoe.
Yeah.
Right? So you'll see young kids getting around with runners and all that sort of stuff on. You go past a shoe shop, you'll see runners for very, very small kids. So the moment you put the runner on the kid, you've contained the feet.
Yeah.
Okay? You've taken away the sensation that's coming up through the sole of the feet.
Yes.
You've taken away a lot of the muscle action that the foot would be using because you're using the whole shoe to do the work.
Yes.
And so that through those developmental stages, it can be really, really detrimental. So they get through that and then they go to school. So they get to school. A lot of the school shoes, the leather ones, have a big toe box, which is good. But again, their foot's contained in a shoe. And now we get runners that look like school shoes, but they've got narrow toe box, they've got a higher heel.
Yeah.
And so we get through school and we move on and we continue to wear our runners and it elevates our heel. Yeah. So now we're Achilles and calf are adaptively shortening.
Yes.
Okay, they're not getting to their normal length, if you like. So we're creating another problem on top. So tight toe box, and we'll talk about having toe splay as necessary for walking and for balance, but our toes have to be able to splay out. So as soon as you put them in a shoe that contains that, you lose your capacity to balance as much, and the muscles don't work as much when you toe off.
I see.
We talked about the heel raise. The cushion decreases sensation coming up from the ground through the foot. Now that can be okay at some stages, but and then often we put an orthotic in there. Again, people will say, got flat feet, so I need an orthotic. I'll go and get a product. Yeah, go and get an orthotic, bang it in.
Yes.
Very often it's not a structural flat foot. The easy way to see is if you get them standing and they put the foot down, it goes flat. But if you sit them down and they pick the foot up off the floor, the arch will return. So those sort of people don't need an orthotic. They need some strengthening in there. Right?
Yeah. Which we don't tend to teach people, do we?
We don't teach them at all.
I mean, that's one of the points of this whole conversation. It's not something that really is focused on.
No.
In fact, I don't think I've ever heard anybody much focus on it. I guess podiatrists are.
Podiatrists do. And they're we'll talk about orthotics in a minute. But So what happens, let's say with, let's look at a shoe side on.
Yes.
Now, this is a, what do you call it? Minimalist shoe. No, not minimalist. This is a barefoot shoe.
Yeah.
So as you can see, it's got a wide toe box.
Big toe box.
Allows foot display.
Yeah. This is a shoe you're showing us. Not much here.
Not much through here. So what's called the drop in a shoe is how high from your heel to the shoe to the base of your toes.
Right.
So it might be 4 mil, it might be 6 mil, it might be 8 mil in the shoe.
It's got a wedge shape.
Yeah.
And that's
so
much
your
flatter.
heel is elevated.
Yes.
Right.
Yeah.
Then we look at what's called the stack height. The stack height is this midsole in a shoe.
Yeah.
All right.
Yeah.
So let's get another shoe.
So lots of stack height there.
Yeah. So this stack height here. So stack height might be 8.
Yeah.
It might be 10. It might be 12 mil.
Mm.
There's new runners come out now which are meant to increase your performance. They're meant to give you more bang for your buck, if you like.
Yeah, more spring, whatever.
More spring.
Yeah.
Problem being, as soon as you put a stack height and a cushion in,
Achilles shortens.
your stride lengthens.
I see.
Right? If you're running, what you want to do is not overstride, not put your foot outside your centre of mass too much.
Mm.
Right? You want it to be underneath you.
Why?
So the foot,
Why?
well, as soon as you extend it out and you heel strike, the foot can't do what it's supposed to do, right? It can't absorb the shock and everything. The shock goes through the heel, up to the knee, up to the hip.
Yeah.
So you'll often see people, if they run in shoes with quite a big stack height, or they run with an extended stride, they might present with knee pain. It's not the foot, the knee.
I suspect most people don't think about that or know that.
No, because this lower limb chain, it works from the foot up, through the knee, through the hip, and even into the core muscles.
Mm-hmm. Yeah.
And vice versa. It works down the chain as well. So stuff up the top has to perform in a certain way, to position the foot in a certain way to allow it to absorb shock, toe off and go on.
Yes.
And as soon as you put your foot out in front of you, even walking and heel strike, it will engage the posterior part of the pelvic floor.
Okay.
Right? So there's all that involvement all the way down through the lower body.
How important is that if you're just walking using runners? So if we versus runners, someone running, doing a whatever competition.
We'll get on to horses for courses if you like.
Yeah. So we've got the minimalist shoe.
Okay. Let's just talk about the foot itself. What's it designed to do? As a bare foot, the calcaneum or the heel bone has a fat pad in it.
Yes.
And then it has tissue underneath it. So when you hit the heel, shock's absorbed.
Yes.
Then your foot comes through and moves towards the midline and flattens out.
Yes.
So this foot's unlocked.
Yes.
So it's going to dissipate energy. It's going to absorb shock.
Yes.
Right? Then as we come to the phase to toe off, we start to supinate the foot. We start to lift the arch up and out, and that locks the foot.
Okay.
So we have a landing and a pronation to absorb shock.
Right. Yes.
Then we roll into a supination to get a firm platform to toe off.
Okay.
Yeah?
Yeah.
So that's what's going to happen. And even muscles outside the leg, outside the foot, the tendons going in, they will work in such a way as to control that movement. In other words, they will work eccentrically to dampen that force coming in.
Mm-hmm.
Yeah?
Yes, I see. And then the toe power is important in that stride off.
My word.
Mm-hmm.
My word it is. So shoes. I'm advocating that people, and we'll finish it off with recommendations, but people choose the right shoe. But probably the most non-negotiable would be the toe box wide, because that's going to allow toe spread.
So we should have a wider toe box?
Toe box. I'll tell you how to check for it. And horses for courses, because we've got specific footwear for specific things. A netball shoe to a running shoe. A running shoe, you're going to be moving in that one direction, okay? And, you might want a little bit of shock absorption and all that sort in it and all that. The stability, hopefully, if your foot's well trained, will come from the foot itself. If you talk about a netball shoe, what are they doing? They're pivoting.
Yeah.
So the shoe has to be designed differently to take those forces.
Yeah. Right.
So if you play netball in a running shoe, for example, you're more likely to twist your ankle. You roll out of it.
Yeah.
Okay.
Yeah.
Ski boots are a classic example, right? We can't go and play tennis in a ski boot.
Difficult.
Yeah.
Yeah.
I know you're a good tennis player, so if I take you on, I'll make you wear ski boots.
Maybe pickleball.
Yeah. Because you want the boot to transfer the force you are doing to the ski, to the edge, and so on.
So that's the shoe wear, and you're like a bigger toe box.
Yep.
Tell us exactly how you would work out what your toe box should feel like.
Okay. So let's say you're wearing your normal shoes that you normally do.
Yes.
Best thing to do is to take the insole out.
Yes.
Put it on the ground.
Yes.
And stand on it.
Okay.
If your foot or toes extend outside that insole,
yes,
it's not big enough. Simple. Where people think it's big enough is they step into the shoe's a mesh top, so it pushes out at the top.
Yes, I see.
Okay, and it feels like it's got room.
Yes.
But when you go for toe splay, when you want to toe off, or you step forward first and then toe off, there's not enough room. So you want to make sure that your foot, put it down, stand on it, even pick your toes up, spread them a little bit, and they should stay within that confine.
Alan, I find that, the heel, the spongy part of the heel that which is a bit high, gives you that sort of wedge that we talked about. That, for me, makes the shoe feel a bit more comfortable.
Yeah.
But you're more advocating a minimalist sort of shoe so that you get more feeling through the calcaneus.
Yeah.
And you can improve foot dynamics.
Yeah.
But, would you recommend that kind of shoe for running? Because I would suspect if I used a shoe of a minimalist nature that it might jar a bit.
What you don't do is you don't go from what you've got now to a barefoot shoe. You'll be crippled. It's a transition. Might take 2 years.
Okay.
Right?
Yeah, because
it's not a short process.
Because you're learning something new.
Well, and your foot's weak.
Yeah. Yeah. You have to
got to build the strength.
Train it up.
That might take 2 years.
Yeah.
So what you would do? So a minimalist shoe has a zero drop.
Yes.
Like a barefoot shoe.
Yes.
Minimalist shoe has a stack height.
Yes.
Which is going to give you cushioning.
Yeah.
So my transitional phases would be go from normal runner that you've got. If you want to go this way, it's not for everyone.
Yes.
Normal runner, transition to minimalist, transition to barefoot, if that's where you want to go.
Yeah.
And as I said, that process might take a number of years. So what you do, you get your new shoe and you wear it for 10 minutes.
Yes.
Day, 10 minutes a day. Then after a few days, feels all right, you might go 15 minutes a day.
Yeah. Yeah.
Then you might get up to, I'm only going to the supermarket, I'll wear them there and I'll come home, take them off.
Yeah, I see.
And it's all good.
You customise
it's graduated. Yeah. So what you can do, if your shoes at this stage you don't feel are quite wide enough in the toe box, you can lace them differently.
Yeah.
So miss the bottom two eyelets and start at the next ones.
Okay.
Because that'll allow a bit of spread in the top of the shoe.
More space.
Yeah. The other thing is take the insole out.
Alan, if we were sort of thinking more, that's for the younger person, I guess, or middle-aged person, for maybe older patients or patients who are trying to improve their foot dynamics and foot strength, take us through the sort of things that would help us get better spread of the toes, better dynamics, better toe strength, all the things that we're talking about, better proprioception, all the things that we need to really be able to hold ourselves in good balance and poise, and hopefully avoid an untimely and unpleasant fall. Take us through the sorts of things that you recommend.
Where I'll draw a few examples from. We ran what do you call it, pilot workshop, if you like, with half a dozen or 7 people, possibly all around 70.
Yes.
Okay. We tested, as we did with you before, we tested stability, strength and balance and their toe dexterity, if you like, how they can move their toes independently.
Yes.
Once we've gathered that information, they'll sit on a certain point, some better than others, whatever. First thing we introduce is toe spaces.
Yeah.
Right? So we give them toe spaces. They use them when we're at the gym, but we use them at the gym and then they wear them at home.
And what's that training exactly?
That's spreading your toes.
So your toes are spread, so you're getting better feeling through your toes.
Yeah. And some people's toes haven't spread for 30 years.
Effectively like a bigger surface area too. Yep.
Yeah.
So we have to work on that. Toe spreaders.
Toe spread.
Done.
Right. That's so easy. That's low-hanging fruit because I say to you, Luke, I want you to wear toe spaces. I don't want you to wear them all day, every day, but I want you to have them on for an hour.
An hour, yes. So
go home, I'm going to watch the news. I'm going to watch whatever.
And wear them.
Put them on.
Yeah, okay.
Get up, go to the kitchen, still have them on.
Yeah.
We're getting toe spread.
Okay.
The next thing I get you to do is to mobilise your toes.
Yep.
So we get your hand
Yes.
Put the fingers between the toes. Sometimes you really got to force them in. You might be able to get them in only 2 or 3, but then eventually all.
Yeah.
Then lock on, and we start to mobilise, right? So we're getting movement into those joints.
You're bringing your hand, your foot up.
You sit, cross your leg over your knee if you can.
You're going like that?
No, like this.
From underneath?
Yeah.
That requires a little bit of dexterity.
It does.
But okay.
But it's good for you.
Thank you.
Yeah. And then you start to mobilise.
Oh, so
right? How
long should we do that for each day?
Oh, I do it if I'm watching something on the telly.
Yes.
And then I'll get the toes and I'll pull them apart, stretch them open, stretch them open, stretch them open.
Yeah. Well,
because they haven't been there for a long while.
No, most people would not do this, but that's a very good exercise.
Well, only sitting down there. You may as well do something.
Well, thank you. But we don't tend to think of this.
No, we don't.
No, but that's a great exercise.
We don't.
So we're using toe spreaders. We're using our fingers as well to help spread the toes apart.
Then we do, are you ready for this?
Yes.
You don't have to wear a caftan. We do toe yoga. Right?
Yeah. Okay.
Right?
Tell us about toe yoga.
You got a taste of it before.
Yes. Yes.
We're sitting, heel on the floor, knee at right angle.
Yes.
And we independently lift the big toe.
With the other toes.
Other toes flat on the ground.
And not clawing the toes.
Not clawing.
Which is
so they have to be flat.
So we've got the foot flat on the ground. We're sitting on a chair, foot flat on the ground, socks are off, etc. And we're just going to focus on bringing the big toe up with all the other toes on the ground. And that's not so easy to do initially.
It's not.
So you could hold your other toes down with your hand. That's not cheating.
No, it's not cheating.
And just work on picking the toe up.
Now, here's the hint. You ready for this?
Yes.
This is a take-home just for you, Luke, and you will remember it the way I say it. You ready?
I'm ready for it, yes.
When we first start and we want to lift our big toe, we find it difficult.
Yes.
We don't go and ski the black run immediately. We start on a green run.
Right.
So even if it only comes a couple of millimetres off the floor, that's the start.
Okay.
And the more we do, the higher it will get. We'll get to the black run. Yes. We'll get it right up.
How long should we work on that each day?
If you've got time, you may as well sit there. If you're just sitting down, if you've got a bit of toe spread in your shoe, you could be sitting at your desk writing notes. And you could just be picking your toes up, spreading them, putting them down.
I think that is an easier exercise than actually trying to get the big toe engaged to move separately.
No, but you've got to do it.
Yeah, well, yes, no, thank you.
Now, here's the other thing.
I'm just saying, it's not that easy.
Tonight's full of hot tips just for you. Are you ready for this?
To my attention.
There'll be an exam at the end.
Thank you.
All right. Now we're going to do the other 4 toes independent of the big toe.
Okay.
Right. Now you can stimulate a little bit, but just by running a hand up over the tendons at the back, that'll wake it up a little bit, and then
you're moving all the other ones together. Okay.
Yeah.
You can't get
so toe yoga.
You can't get independent movement like.
And then we might do 2 big toes, 2 big toes.
I see.
4 toes, or 4 toes.
I see.
Yeah.
So now that's good. So we've got big toe movement, we've got little toe movement, we've got the toe
spreaders.
Yep.
And whenever we pick, and even just picking your toes up, spreading them, and almost trying to take them away from your foot, push them out, and then place them down, not down.
Yeah.
Yeah. Then spiky balls. You know those massage spiky balls?
Yes.
While you're sitting there, put it under your foot.
Yes.
Roll your foot on top of it, push down on it in various spots. You'll feel it push in.
What does that do exactly?
Well, we're stimulating nerve endings.
Okay.
So
will a tennis ball be okay? Or
tennis ball's fine.
Yeah.
But the spiky ball really gets in. Yeah. But tennis ball's great. Yeah. Golf ball.
Yeah. And that should be with the socks off, preferably, or does it?
Yeah, you could do it with socks off, socks on. But socks on.
Yeah. Okay.
Probably. Then the intrinsic muscles, the small muscles of the foot, particularly the ones that attach, or the one that attaches to the base of the toes. You can do that by doing calf raises.
Yeah.
But if you were to roll a towel, put your toes up on the towel and the balls of your feet off the towel.
So you roll the towel into a sausage,
little sausage,
put your toes on the
sausage
of the towel,
and then you raise up
with your wheels.
Okay, because that's really going to engage those intrinsics.
Mm.
And if you're going to be doing calf raises, you may as well get the foot involved.
Yeah.
Okay. So there's just a little routine. Then, of course, the people that we've been working with, we do that. Then we do balance work. I didn't test your balance, but we do balance work. Now, what we want to do first up with most people is get them, when you walk, you spend 40% of your time on one leg. Running, you spend, I forget what it is now. a whole lot less, as you're striding. So a lot of the work's done on one leg. So we want to balance on one. So you put the foot down, do our toe spread. There's this what's called a T-bar. It goes across the base of the toes. Actually, it's a transverse longitudinal ligament runs through there, but it goes across there. And then if you draw a line down to the middle of your calcaneum, it's a T.
Okay, yes.
So when we put our foot down, we want to spread the toes and we want to come onto the T. We want to feel here and we want to feel the calcaneum.
Okay.
Yeah. And then we start our balance.
Yeah.
Working through progressions to eventually stepping out and landing and holding it and balance. Yeah. Because what do you do when you initiate gait? Take it forward, put your foot out, stand on it.
Mm.
That's what we're encouraging.
Okay.
Make sense?
I'm not sure how that's testing your balance exactly. So you're
No. We've done our balance testing,
right?
like we've done these others.
I see. Right.
Yeah.
Okay. This is improving our balance.
Yes. This is to train it.
Okay.
Eventually, you might get them standing on one leg, and if it's say the left, the right leg, you would touch the 12 o'clock, 3 o'clock, 6 o'clock, and work round.
But when I was
younger,
my stepmother had, she was a physio, and she had a flat circular piece of...
So she talked you out of being a physio.
Timber.
That was good.
Well, I think I was already doing training, but she had this flat circular piece of wood with a slight...
Wobble board.
A wobble board, yes.
Yeah,
and
we use
got
those.
on that, and you still use it.
Yeah, we still use it.
Which I found quite interesting
ball.
to do. And a Bosu ball for balance. So you still use those?
Still use those. And then, like, the ones that are quite advanced, you put weight in their hand.
Yeah, I say yes.
And get on the ball or the board.
They're a great set of exercises for the feet. Tell us about the other, like the calf up into the thigh muscles and the buttocks. How important is it to maintain the strength and functional capacity there? I always thought that the gluteus muscles were the more important ones. But
they are.
Yeah,
they are.
They're certainly important, but you've drawn my attention to the importance
well, what
of
we've started with, obviously, we've started with stability. We start at the feet, and then we come up.
Yeah. Tell us about coming up. Just take us through that.
Okay, so we're sort of deviating a little bit. Yeah. We're getting into more gait assessment now.
Yeah, that's okay.
When people are walking.
Yeah.
So what has to happen, as you take a step forward and you land on the forward leg, the gluteus maximus controls the internal rotation of the femur.
Right, okay.
Which is controlling the pronation of the foot.
Right.
Yeah? As you come onto that one leg, remember we want stability whenever we're doing anything.
Yes.
So we need stability of the pelvis and the hip. That's when gluteus medius comes in, the very small one that runs from the pelvis down to the hip, because that maintains your pelvis level in single leg standing. And you would have seen it, I'm connected up here so I can't demonstrate, but a Trendelenburg gait, you'll see people walking and they do this.
Yeah.
Right? That's a weak gluteus medius.
I see.
Right? Because they can't maintain their pelvis level when they're standing on one foot.
How do we strengthen the glutes?
Oh, glutes, normal glutes exercise. What's its action is to abduct the hip.
Yeah.
So we do hip abduction exercises and strengthen it. The gluteus medius.
Okay.
Yeah. Make sense?
Yes.
Yeah.
So hip abduction for gluteus medius.
Yeah.
Yeah. And gluteus maximus.
Extension,
dead squats
extension and rotations. Yeah.
Okay.
Yeah.
And
then obviously quadriceps, hamstrings, calf, so on. But we got these people for a small period of time. Got to try and, if we're taking a shot, we've got to try and hit the target.
Yes.
Right? So we'll start stability at the foot and then we'll come up. If we see a deficiency somewhere, you can, for that particular person, you might say, look, I want you to do this. There was a lady in the group, I was actually at the thing when she fell last Christmas and fractured 2 bones in her foot, and she's still not perfect.
Mm.
So I gave her some varying exercises to do for her particular problem, which I didn't give to the others. Right? Just sort of single them out because that will help her move along. But it was interesting because all the parameters we tested with the balance, with the calf strength, with the toe strength and so on, I reckon after about 3 weeks we're noticing a difference in that. They were improving.
Mm.
So, and then after 6 weeks, and then the other thing to do with the exercise, of course, we're talking about this, the sensory nerves going off.
Yes.
If we can exercise and get blood flow into the area, you actually get nerve fibre branching. So you'll improve the sensation, which we want to get. So with this group, we also talked about doing not just walking, but doing intermittent walking. So it only takes 12 minutes. Okay. So it's very, very small amount of time. So walk for 3 minutes, normal pace, slow, easy going, blah, blah, blah. And then walk as fast as you possibly can, going for it for
Power
3
walk.
minutes.
Power
walk for 3 minutes.
Yes.
Then 3 minutes slow, and then 3 minutes fast. That's the end of it.
Because you're going to engage way more muscles in the feet.
Well, you're going to breathe more.
Yeah.
Heart's going to pump harder.
Yeah.
All those.
Alan, I don't think there's nearly enough discussion.
One thing.
Yes.
And we mentioned it, or I don't know if we mentioned it on the tape or the recording, but we talked about when should you start all this. Well,
yesterday.
Yeah, exactly. Good answer.
Yes.
I reckon you should be aware of it and possibly starting back before middle age. Now, we said what middle age was, 42.
That's rather shocking, isn't it?
Well, it's sobering, isn't it?
I didn't think I'd met middle age yet, Alan.
Well, it is.
That's
because, why do I say that? Because the girl who I work with on the course, she's 37, right?
Close to middle age.
Getting there, I must remind her.
Yes.
She'd be very happy about that. Was a professional tennis player.
I see.
Right?
Yeah.
So not what's the right word? Knew what exercise was, and now she's a personal trainer. She gets up at 4:30 to train. So she's fit.
Yes.
Now, we tested her toe strength. Interestingly enough, on one foot, her big toe was really it was weak.
Right.
The other 4 toes on that foot were all right. But on the opposite foot, it was the opposite. Her big toe was strong, but the 4 toes were weak. Now, there's someone who trains every day.
Probably.
But she did have her footwear has affected her because she's got a tailor's bunion, right, which is a bunion on the outside part of the foot, not the hallux valgus and the bunion on the big toe.
She's probably never had anyone actually sit down though and talk about the foot exercises.
Never.
And I think the good thing about the conversation now is you bring this to our attention. And I suspect if people do these exercises that you're advocating, getting their toe strength up, the great toe strength, getting more mobility by spreading their toes and doing the exercises you've discussed, improving their balance, and then working also on the calf, the thigh muscles, quads, hamstrings, and the gluteus muscles, then they'll feel more confident, they'll walk more, and by walking more, we know this not only expands our longevity, as we've seen all the studies, people that are active live longer, and they'll tend to have less falls and avoid that, hopefully, that terrible morbidity that comes with falls.
Well, if you think about it too, everyone casts around to 10,000 steps. Well, there's nothing scientific about 10,000 steps.
It sounds good, I think.
It sounds good, but it was developed by the Japanese to sell pedometers.
I see, right.
In America, the average, this is where I could only find it, the average step count for people is around about 4,500, the average, per day. So 4,500 means that 50% of the population are under that, doesn't it?
Yes.
Yeah. If you're under that and you can build to 4,500, 5,000 steps a day, there's been evidence to show that it decreases your risk of Alzheimer's. If you can get up around the 8,000, it decreases cardiovascular risk.
Yeah.
Right? So we should be aiming, if you don't get 10,000, don't beat yourself up. But if you can get up there, that's all right.
What we want to do, Alan, we want to live from the feet up.
And we want to be able to move.
We want to be able to move freely. And, maybe we can come back at another time and talk a little bit about stretching, because I feel that flexibility is a very important part and freedom of movement, this is partly that for sure. It's a very important part of us feeling good about life and achieving, the goals and the sort of life that we want to have.
Yeah.
Thank you so much for bringing again your expertise, your intelligence, your good humour and knowledge, and really, I think raising a very, very important issue that we all should be aware of and probably haven't been thinking about enough. So thank you so much for joining us. We'll look forward to seeing you soon. Now I've got some crayfish for you. We're going to go on tuck into some Chablis and crayfish as promised.
Lovely.
We'll see you soon. Thank you very much.
Thank you.
Thank you for joining me on this interesting podcast episode with Allan Abbott. I learned a lot about toe strength, proprioception, muscle strength, the sort of footwear we should be considering. And I think these exercises are now part of my daily routine. Death from the feet up, a very important concept. Well, during the podcast series, we will be covering a wide range of topics across many specialty interests. I hope you'll join us with our next guest in a couple of weeks. The discussions are not intended as specific medical advice for patients, but as general information only and reflect the opinions of the guests interviewed. Requests for new topics to be reviewed and comments about the conversation you've listened to are welcomed and may be emailed to manager@yourhealth.com.au.